As we know, Black and Brown women have borne the brunt of this crisis in healthcare, jobs, caretaking, etc. Um, it's just different for women of color. It's more critical, it's more devastating. What are the answers? How can we pay special attention to these folks?
So, listen, I think that the pandemic has exposed the failures, the fractures, the fissures that have long existed in our society and has made them bigger and more obvious. We had racial disparities long before this pandemic struck. And when we talk specifically about Black women, take, for example, the fact that even before this pandemic, Black women were 3 to 4 times likely to suffer from maternal mortality, to die during childcare or childbirth than other women. Let's take, for example, what we have seen during the course of the pandemic, which is that Black folks are exponentially more likely to contract the virus and die from it because of longstanding disparities around the delivery of healthcare and healthcare accessibility. And when we talk about Black women specifically, you can look at the frontline workers. Those folks who, be it in childcare or in healthcare, who throughout the pandemic have been going to work every day, often taking public transportation, exposing themselves during the course of getting to work, much less at work, to the virus, and but doing the work that has actually been about saving lives, but taking a much bigger toll in terms of the harm that they've experienced from not only exposure to the virus, but exposure to the inequities around pay, around paid family leave, around paid sick leave, around affordable childcare. These are all issues that have disproportionately impacted Black women in the workforce. I'm told the majority of minimum wage workers are women and women of color, right? And by the way, federal minimum wage is $7.25 an hour, and the math on that is that's $15,000 a year, right? And we are talking about those same jobs disproportionately being jobs that do not give paid sick leave, paid family leave. Those are jobs that make childcare unaffordable. And so what do we need to do? We need to have a commitment to universal paid sick leave, paid family leave. We need to have, and this is part of what we have done in the American Rescue Plan, saying that childcare needs to be affordable and available, because we have many places in the country, including our rural communities, that are experiencing what we call childcare deserts. So even before the pandemic, there just was not childcare, it was not available, and it certainly was not affordable. So these are some of the things that we need to do. We also need to value the dignity of work. And when we look at the jobs that women are performing, in particular in lower wage positions, these are the jobs that invariably are about caring for other human beings. And we as a society should value that. It's an incredible gift that they give us as a society. But we have sadly diminished our recognition of its value and the reflection of our diminishing appreciation of its values, that we're not paying people enough money to do the work that they're doing.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.